Can you please tell me more about what happened? Can you please tell me more what happened? What exactly did you feel at the time?
Mm. Actually, I have a palpitation 2 weeks ago when I have a golf course.
Hello.
المفروض ان انا اقول كاركتر ولا استقلني ولا ايه؟
انت خلصت، انا حسيت صوت قطع كده عندي فجأة.
وانت هتقول له اللي حصل، هو بيقول لك اللي حصل بتفصيل، فممكن تقول له عادي كل الكلام اللي حصل.
You had
So I have one episode of palpitation 2 weeks ago when I am during a golf course. This palpitation comes suddenly and abrupt also suddenly. Start about 5 minutes.
Okay, so all of a sudden you have this palpitation and lasted for about 5 minutes. Is this your
Yes.
first time to have this kind of palpitation?
Yes, this first time.
First time. And only it lasted for 5 minutes. Has it stopped by itself, or you needed to do something to make it stop?
No, it's abruptly stopped.
Okay, it suddenly stopped. Okay. And at the time, were you doing any kind of exercise more than usual, or it came while you are at rest, or at least not doing massive exercise?
Yes, it's come when I try playing golf during the course of golf. This is the first time.
First time, okay. Okay. At the time, did you have chest pain?
No, I don't have chest pain.
Even before or after this palpitations?
I feel just dyspnea and fainting, and I feel exhausted.
Okay. But have you lost your consciousness?
No.
Sorry, you didn't lose your consciousness?
No.
Okay, that's fine.
But when I come back to my home, I feel exhausted, extremely ill.
Yeah, okay, I can understand that. Sorry to hear that. And just a few days before this palpitations, have you got any spikes of fever, any cough, any runny nose?
No, Dr. Khalid.
Okay, that's fine. And at this palpitation, during this palpitation, did you have?
But I have some bronchial asthma, and I take inhaler for that, and it's controlled.
Yeah, I can see this in your GP letter that you are having late onset asthma. Actually, it's mild late onset asthma for which you are on salbutamol.
Yes.
And how often do you use the salbutamol? Or this inhaler, I mean.
مش مكتوب بس هو twice daily.
Okay. And did you use it straight away before having this palpitation? You know why am I asking? Because salbutamol actually is one of the medications that might cause a rapid heart rate. That's why I want to make sure you didn't overdose yourself with salbutamol. Do you think that you had?
No, I think it's I'm regular in my medication, and the bronchial asthma is controlled. Everything is okay.
Okay, that's, you didn't use it too frequently before having these palpitations?
No.
Okay, that's fine. And did you have headache as well when you had this palpitation?
No, I don't have headache. Just feeling fainting, to be fainting.
Okay. At the time also, did you have any kind of weakness? Have you felt that you had any kind of weakness?
Yes, this from long time, about 5 years ago, I have one episode of TIA, and I have a weakness in my right hand.
Has this weakness changed
Since that,
over the last 2 weeks?
now everything is okay.
So you don't have any kind of weakness right now, is that right?
No, yes, it's right.
Okay. And during these palpitations, also you didn't have any feeling of weakness, even temporarily or for a short period of time?
Yes, I feel I feel exhausted after this episode, and I feel it's extremely ill. When I come back to my house, I feel that I feel exhausted.
Yeah, but I mean a kind of weakness like you had before when you had got this TIA, like one side hand weakness, one side leg weakness. Did
No.
this happen?
No. This one episode since 5 years ago. This only one. Now it's
Okay.
correct. Things okay.
Okay. And are you on any other medications apart from aspirin that was written here? I mean, for this kind of TIA?
Yeah. I only take aspirin.
Mhm.
Only.
Okay, you can you already on aspirin because you have
Salbutamol. Only.
yeah. Okay, you are on aspirin because of this TIA 5 years back, and you are on salbutamol because of the bronchial asthma. Also, what I can see here that your thyroid function is normal, and you had an ECG done by your GP, which was in a normal sinus rhythm, which is the normal rhythm we usually have. Your blood pressure is also well controlled, and you are not in any blood pressure controlling medication.
Yes.
Okay. So I think now the problem is that you had one-off attack of dizziness, palpitation, which lasted for 5 minutes, wasn't associated with any other, from what I can tell from the history are giving me, it wasn't associated with any other serious events. But
yes,
but because palpitation and dizziness, especially in someone in your age, is a serious thing, we need to investigate further and to clarify what is the cause of these palpitations.
So it's a serious condition, Dr. Khalid.
At the moment, I can't say it's serious condition, at least until we know exactly what is the cause of this palpitations, and if it is recurrent or you are at risk of having it again or not. For that, we will need to do some further investigations to make sure that everything is fine.
Okay.
The investigations we will initially need you to have as a 24-hour tape. It's a device that will be connected to your chest to monitor your heart rate over a 24-hour period of time.
Good.
We can arrange this for you. You will have this machine connected to your chest. This device connected to your chest here in the clinic. Then you can go home and return back next day, and then we will see the reading. It will give us an idea if you have this kind of palpitations during a 24-hour. Sometimes we may ask it to be 48 hours. So basically you will have it for 24 hours or 48 hours. Another kind of investigation is ultrasound to the heart. We call it echocardiogram. It's like ultrasound of the heart to assess your heart function. It will give us also an idea about how good is your heart.
Okay.
And also we might ask for another routine blood investigation. I can see that you have some done by your GP, but we will ask for another blood works to complete the picture until I can tell you exactly what was the cause of this palpitation and if you are at any risk of any further attacks, or if we will need to give you another further medications. Is that clear for you now?
Yes, clear, Dr. Khalid, but you have any advice for me after that or until this result back again?
Yeah, it's a good question. My advice for you now is like any other like any other advice I could give to you generally. You need to keep yourself healthy and fit. Don't do external exercise. If you want to do any kind of exercise, okay, you can, of course, you can still play golf or you can walk, for example, if you want, but don't exhaust yourself in very strenuous exercise, at least until we have the result. Of course, you need to eat well. Try to avoid fatty food, junky food. You need to eat healthy food, practice exercise, and do you smoke?
I was a smoker, but I quit smoking since 23 years ago. When I'm a smoker, I smoke 10 cigarettes per day. I quit from 23 years ago.
Okay, that's fine. And you don't have any breathing problems
No, I don't have.
apart from the asthma, of course. Okay, that's fine. Yeah. So my basic advice for you now is to do light exercise, eat healthy food, avoid fatty and junk food, and then we will arrange for the further investigations I told you about.
Okay.
Yeah.
Minute remaining.
Thank you.
Do you have any other concerns or questions for me?
May explain the plan of treatment, of plan of management for me.
Yeah, for now, we need to arrange for the further investigation, the 24-hour tape, the device that will be connected to your chest to trace your heart rate over 24 or 48 hours to see if you have any kind of palpitations or arrhythmia, which means irregular heart rhythm. Secondly, we will do the heart scan, and then we will take it from there.
Okay.
Okay, that's fine. But before you go, let me ask you a final question, please. Who do you live with?
I live alone, my home.
You live alone. Okay. And are you independent with your activities of living?
Yes.
Okay, that's fine. You can do your shopping, you can do. Okay, and you don't have any carers?
Yes, I don't have.
Okay, okay, that's fine. I'm happy with that. So we will proceed for the plan as I told you, and I will see you again after having the result or the outcome of the investigations I told you about.
Okay, thank you, doctor.
All right. Thank you for coming today and see you later. Goodbye.
السلام.
اوكي تايم اب. دكتور احمد ده فين؟
موجود يا دكتور عايشة.
طيب انت الوقت عندك مش شغال ولا ايه؟
لا لا شغال، انا مستني. سوري معلش، انا اللي سرحت. حقك عليا.
لا لا اتفضل. طب 1 minute دكتور خالد وبعدين دكتور احمد هيسألك.
1 minute لإيه؟ خش.
هو المفروض في 1 minute بتعمل لنفسك فيها يعني differential وتجهز نفسك للحاجات الأسئلة اللي بتسأل بعدين هو بيسأل.
جاهز diagnosis الديفرنشال والمانجمنت بتاعتك.
يعني اوكي ماشي، بس هو يعني غالبا هو اللي انا اشتغل
طيب
معاك.
what's your diagnosis؟ يلا يا دكتور خالد what's your
ماشي
diagnosis؟
ماشي. This palpitation for the first time. I still don't have definitive diagnosis now, but I need to investigate further to know if he has any kind of arrhythmia, which we can detect by the 24-48 hours hold.
What's your differential diagnosis؟
My differential diagnosis initially it might be arrhythmia, any kind of arrhythmia, ectopics, maybe one of the top, one of the top of this arrhythmia because his current ECG is sinus rhythm, so he might have a kind of topics. It might be paroxysmal AF. That's why we need to. He already has normal use and ease. but still AF is one of the possibility. Heart block also, like first degree heart block or second degree heart block, remains one of the possibility of this arrhythmia. In general, it's arrhythmia and the sub entities under arrhythmia.
What's your plan of management?
For now, I will keep him on his regular medications until we have the 24-hour tapes, until we have the result of the Holter exam. And echo. He's already an aspirin. If by echo there is any evidence of ischemic heart disease, we might give him some anti-failure medication if he needed.
Are you going to admit this patient?
I will not admit him at this point. His observations are normal. He hasn't got any palpitations at the time of review. His current ECG is normal sinus rhythm, so I will not admit him at this point.
Okay. Your differential diagnosis mainly heart problem. Is it?
Yes, if he has any kind of electrolyte imbalance that might cause palpitations and AF, by his GP letter, his thyroid function is normal, so I could exclude thyroid disease, but thyroid disease is one of the cause of palpitations. If he has any kidney problem that might cause, again, electrolyte imbalance because of the kidney disease, it might cause like TIA, stroke, might cause dizziness and palpitations. Infection might cause tachycardia actually, and with tachycardia, infection and fever might cause tachycardia, and this tachycardia may give him a feeling of palpitations. So I also need to exclude any source of infection, but clearly by history and observations, we can say roughly he hasn't got any evidence of infection.
Okay, thank you, Dr. Thank you.
You're welcome.
اوكي طيب هو طبعا دكتور خالد يعني كان في بعض الميسنج في الهيستوري، يعني كان الدنيا شوية فيها الفاميلي هيستوري ما تكلمناش عنها. سيستم ريفيو، يعني كان في سيستم لازم يتعملهم ريفيو زي مثلا الثايرويد، الاندوكراين. شوية ما سألتش عن الويت لوس، على symptoms of anxiety، ما سألتش عن الدايت. هل لأن أحيانا ممكن تكون الكافيين والحاجات دي ممكن يساهم في موضوع البالبيتيشن.
صح.
سايكولوجيكال ايشو مهمة، لأن أحيانا كتير البالبيتيشن سايكولوجيكال، برضه تسأل هل في أي symptoms تانية. يعني إحنا عامة السيستم ريفيو كان هيجيب لك كل الليستة دي، لو أنت خدت كل سيستم بسرعة كده إيه اللي هيبقى مهم فيه، فكان هيبان إذا كان في أي ريليشن للسيستمز ولا لأ. خصوصا موضوع الثايرويد، خصوصا موضوع السايكولوجيكال. طبعا سألت في الآخر على الإمباكت، فده المفروض كان يبقى فيه ترتيب في الأول، يعني أنت بدأت له على طول إن أنت أنا شايف إن حالتك كذا وكذا، فده كان المفروض يتأخر شوية يعني.
صح. هو أنا لقيت نفسي مش لاقي حاجة أقولها، عارفة، فقلت كده بس يعني.
عشان كده يعني لو تبص على السكيم كده اللي أنا حطيته تاني على الجروب دلوقتي، هو هيخليك فاهم أنت إيه الدنيا هترتب معاك بالظبط إزاي. المفروض انت هتسأل عن الفاميلي، هتسأل عن السيستمز كلها، هتسأل عن السوشيال، هتعيش فين، عايش ازاي،